Hello everyone and welcome again to another Max Doc Talk. Today is World Kidney Day and joining us is a very special guest. We have Dr. Alka Bhasin, Senior Director in Nephrology and Kidney Transplant here at Max Smart Super Specialty Hospital, Saket. Hello Doctor.
Good morning everyone and thank you for joining me for Facebook Live. On the occasion of World Kidney Day today, I'll be answering some of your questions relating to kidney disease and urinary ailments over the next 15 to 20 minutes. The theme for this year's World Kidney Day is Kidney Health for All. Chronic kidney disease is a significant health problem for any nation, and it is a significant cause of death in our own country as well as across the globe. It is often referred to as a silent killer. Silent because most of the individuals affected by chronic kidney disease often display no symptoms whatsoever till the most advanced stage of the disease, by which time approximately 90% of kidney function already has been lost. And killer because many people are indeed dying from it. Most of you would have heard of the importance of the HbA1c value in the control of diabetes and the importance of blood pressure measurements in the control of your cardiovascular health. But how many of you have heard of the blood creatinine value as a marker for kidney disease and kidney health? Let me tell you here that this number, the creatinine value, should be below 1.0 milligrams per deciliter, at which point the kidney's functioning is perfect and effective. So with this brief introduction, let us move on and answer some of your questions today.
Thank you so much for that great intro. And we have a first question from Nishant Ahuja from Meerut, and he's asking, can you tell us about what happens if kidney disease sets in as there are no symptoms?
All right, Nishant, thank you for your question. Nishant is asking about the symptoms of kidney disease. How would one pick it up if there are no symptoms at all? This is a perfectly valid question because it is a silent disease, and for all silent ailments, it is very important to do an annual health checkup. In this checkup, we are looking for a complete doctor's assessment, an assessment of the blood pressure reading, laboratory tests including the blood creatinine value, a urine analysis, and an ultrasound of the whole abdomen covering the kidneys. The blood test of creatinine will pick up any deficiency in the working of the kidney. As I just said in my introduction, that if the creatinine level is close to 1 or below 1, we are okay. But as this number progressively rises beyond 1, the kidney filtering efficiency is gradually going downhill. The urine analysis, on the other hand, picks up abnormalities related to the kidney filters. Are they leaking any protein in the urine? Are they leaking any red cells into the urine? Is there any pus cells or signs of infection in the kidney? And so on. The ultrasound, on the other hand, picks up structural or anatomical problems of the kidney. For example, is the kidney scarred? Is the kidney shrunken or of normal size? Are there any abnormalities like kidney stones, cysts, tumors, or any birth defects on the kidney? So it is very important for you, Nishant, to pick up kidney disease early. Remember that an annual health checkup comprising of all of these things must be done. Thank you.
That was great, Doctor. Thank you so much for your guidance. Our next question is actually from New Delhi. Ram Verma is asking about his mother who is 72 years old. She has creatinine of level 1.58. Is that acceptable levels?
All right, Mr. Verma, the creatinine level is 1.58. Now, to look at the creatinine value is a little bit high because I just mentioned earlier that 1 or below 1.0 is normal. As we grow older and our muscle bulk reduces, our creatinine level should also be somewhere between 0.5 and 0.6 milligrams per deciliter. So indeed, it is abnormal to have a creatinine of 1.58. Let me take an example. If the age of your mother is 72 and let us say her body weight is estimated at 60 kilograms. If I take this data together with the creatinine value of 1.58 and put it into a mathematical equation, we can calculate the kidney's working efficiency, which we also call the glomerular filtration rate or GFR. So just to give you a ballpark, 1.58 would roughly land up to be around 30% or 30 ml per minute. What I'm trying to say here is that although the number of 1.58 looks little bit high but not very high, its meaning is that for a person of blood test creatinine showing 1.58, actually speaking, only 30% of kidney filters are working. In other words, 70% of kidney filtering capability already has been lost. And this is why she must see a nephrologist for further guidance on how to protect the remaining 30% of kidney function, or if there's any option to recover back some kidney function. I hope that was clear.
Thank you so much, Doctor. And that was great. And Ramama, I hope that your mother feels better and she gets the treatment that she needs. Now, coming to another question, which actually is very special. Meenakshi Paul from Gurgaon is actually asking about her chronic dental problems for which she is repeatedly having procedures, and her dentist gives her Combiflam twice a day after each procedure. Is that okay to take?
All right, Meenakshi ji. Dentists and orthopedic doctors, I'll tell you, love to give painkillers. At the end of the day, their patients are coming in with either dental or bone pain, so they have to offer a painkiller at the end of their treatment. So Combiflam belongs to a group of painkillers which we call non-steroidal anti-inflammatory drugs. This class of drugs includes others as well, such as NICE, Nimulid, Voveron, Mobizox, Flexon, Meftal, Disprin, Saridon, and the list is endless. In fact, about 99% of all painkillers on the market fall in this category, and it is this category of painkillers which, although they are very, very effective for pain, even a single dose can land you up with a kidney ailment. It can be a devastating kidney failure or a heavy protein loss of urine from the kidneys out into the urine, and repetitive use can in many people lead to early progressive kidney disease. And that is why, if your procedures are being so repetitive, I would urge you to choose from the safer group of painkillers, and there are only two. One of them is paracetamol for light pain and the other is Ultracet for severe pain. I hope you can try that.
Thank you so much, Doctor. Doctor, our next question actually comes from across the seas. John Bright in Philippines is asking that he has been told to start dialysis as his creatinine is now 8.2. What options does he have?
All right, John, thank you for calling. You mentioned that your creatinine level is 8.2. 8.2 is indeed a very high figure for the blood creatinine value. And I take it that you have visited your nephrologist in Philippines and that there has been an effort to rule out any reversible cause for this kidney problem. And if all that is done and complete, and it is time for you to start dialysis, then let me start by saying that we refer to dialysis and transplantation together collectively as renal replacement therapy. So there are two forms of dialysis, which is hemodialysis and peritoneal dialysis. And as I said, transplantation, all these three treatment modalities together are renal replacement therapy, and we would offer it to somebody whose kidney disease is irreversible and when they have touched a kidney working capacity of 15% or less. And I presume that you have touched that zone of 15%, and this is what we call stage 5 kidney disease. Unfortunately, there are no medicines available in this universe to reverse the creatinine level once it has started to go up. Neither in allopathy nor in alternative streams of medicine such as Ayurveda, homeopathy, herbal, Unani, and so on. So yes, it is time to replace the lost kidney function with something else, and that something else is artificially filtering out your waste products through either hemodialysis or just add extra functioning to your kidneys by taking one donated kidney from another individual and implanting it into your own self. And that surgery is a kidney transplant surgery for which you would require, which is blood group compatible.
Thank you so much, doctor. That was, I hope that John Wright, you can get your answer and you feel better soon. Now, doctor, coming to our next question, which is coming from Mahima Shah in Kanpur. This is about her father. She says that her father has a high uric acid and gets repeated pain in his feet. How can he prevent this?
Hello, Mahima. Your father's problem relates to high uric acid, and while the details available are not enough for me, but I would like to know whether he has a heavy intake of non-vegetarian food, whether or not he takes alcohol, and if there are certain drugs that he might be taking, for example cardiovascular drugs or tubercular drugs, which are often causes of high uric acid. So that requires a little conversation with your nephrologist to understand first the root cause of his high uric acid. Even something simple like dehydration could cause it, and an in-depth evaluation would be necessary. Once evaluated, it is important for you and your father to know that the high uric acid, which is a mineral in the bloodstream, travels via the blood and it then reaches into the kidneys and can deposit to form tiny crystals. Those crystals then become bigger crystals, more crystals deposit on those, and then it becomes a small kidney stone. That is one end result of high uric acid, kidney stone disease. And the other end result of high uric acid is when these crystals deposit on the lining of the joints, especially the joints of the big toe in the foot or in the hands. And when they do that, they create an excruciating inflammation and pain in that particular joint, which seems to be the problem in your father's case. So these are gouty attacks, and of course the immediate reaction is to take a painkiller. And I've just finished telling you that painkillers can be very harmful for the kidneys. So again, the safe painkillers would be paracetamol or Ultracet, and all effort should go into tackling the root cause of your father's uric acid. If it is alcohol, it should be avoided. If he's taking a fair bit of red meat, tell him to avoid that and switch to lower protein sources such as white meat, and pulses would be fairly okay to take. Tell him to drink loads of water and to look at the list of medication that he's having in case any of those are contributing to the uric acid being high. There is a medicine to lower the uric acid level. It is febuxostat, 40 milligrams per day, which he would take in consultation with his nephrologist to lower the uric acid level and to reduce his future risk of episodes of acute gout.
Thank you so much, doctor. And Mama, I hope that your dad follows the doctor's prescription and make sure to visit your nearest doctor as well. Now, the next question, doctor, comes from Lalit Taneja. He's from Lucknow, and he's asking that how can he maintain the best outcome for his transplanted kidney? His transplant had occurred in 2019.
Okay, Lalit, first of all, congratulations. Your transplanted kidney must now be about 3 years old, and that's an awesome feat, so well done. I hope that the person who donated the kidney for you is also keeping in good health, which is very, very important for us on this occasion of World Kidney Day. To keep your transplanted kidney in check, it will be very important for you to visit your nephrologist first of all every 3 months, so that he or she can have a detailed chat with you and assess that your new kidney or transplanted kidney's health is indeed perfect. Not only does that visit help in analysis of what your symptoms are, but it helps to have your weight check, your blood pressure assessment, a physical examination over the transplanted kidney, and an analysis and a trending of your lab reports. Remember, a small rise in your creatinine level can be very significant when you just have one kidney. So do not ignore a rise in creatinine, which might be very small to your eyes, but can have an impact on your GFR. The other things to remember are that the blood pressure control must be extremely tightly done so as to protect the delicate filters of your transplanted kidney. In addition, it is very important for you to screen yourself for new onset of diabetes, which is very common because of the side effects of the transplanted medicines such as tacrolimus and prednisolone. I'm sure you're taking tacrolimus, so do check your tacrolimus level every 3 months and check whether or not the drug dose needs adjustment after a discussion with your nephrologist. Remember to also have a regular screening of your urine test as well as your cardiovascular health to ensure the longevity of such a precious gift that you have received from your loved one. Congratulations to you, Lalit, again.
Thank you so much, Doctor. Now, I'd like to tell my viewers that was all the time we had to take questions. But in case anyone has any other question, please write them in the comment section down below and we will get back to you. In case you want to have a one-on-one discussion with the doctor, you can book your appointments calling at the number on the screen or the link that is in the description. Now, Doctor, before we go, any final words to our viewers today?
Yes, it was a pleasure to take your questions and I thoroughly enjoyed answering them. I look forward to some of your questions later today and will definitely answer them. So I hope that all of those who were able to join in on this Facebook Live, if you were able to take some learning points home to your family today, if you could share them over the dining room discussion and come together and pledge to protect your kidney's health and go for a thorough checkup to ensure that this day and each passing day, your internal organs stay in good health. Wishing you all a very happy World Kidney Day 2022. Thank you.